Well, today is International Overdose Awareness Day. It's a day of awareness and remembrance for those whose lives have been touched by substance abuse and overdose. We've had a great program today featuring speakers Mayor Mitchell, Chief Preventer, representatives from the U.S. From the Attorney General's office, and a variety of other partners in our effort. But it's really focused on people that are trying to address this issue in a grassroots level, families that are struggling with addiction, and we're here to support, spread the word. If you'd like to get involved, send us an email. You can find us at drugfreenb.org and get in touch with us. Join our coalition. Be part of the solution. I'm very excited about some of the new initiatives that we're working with. We've got a very close friend who will be closing our meeting today, Pastor Dave Lima and the Interchurch Council. Him and his churches have partnered with recovery coaches from Seven Hills, PAACA, and others, along with our New Bedford Police Department, to really reach out to addresses where overdoses have occurred. We need to let people know that they're not alone. Whether you're the person that overdosed, a family or a loved one that's overdosed, what have you. Whether you're a family that's in trouble, there's great programs like Learn to Cope. There are also programs like Arise. Arise is a fantastic family building activity, intervention that brings families together and builds strength within the families. It uses the power of the family to try to help. A lot of times families come to me and say, I need to get my son or daughter into treatment, can you just help? And I always ask, what are you doing for yourself? Because quite frankly, this is, no matter how much you love somebody else, and I had to find that out the hard way, no matter how much you love somebody, you cannot love them into recovery. You cannot love them enough to get them in recovery. I know that sounds weird. But we are powerless. That's what they mean by powerlessness. But what we are powerful is our ability to change our behaviors. It's our ability to kind of make a difference, to get involved, to lend a hand, to support, to create conditions so that when somebody is presented in front of you, whether it's a friend, a loved one, family member, whoever, that is struggling, we've got resources so we can help and we can lend a hand. We can't do it for them, but we can help. And we need to be prepared and learn how to do this ourselves. And so we're spreading the message. We're working together as a community, as one community. A lot of different people, a lot of diversity, a lot of different points of view. And that is good. But we're really not resonating with everybody that we need to. It's up to us to kind of come together and really make a difference. I'm going to put the chief on the spot here for a second, if you don't mind here, because the chief I had the pleasure to work with Chief Preventer for probably more years than I'd like to mention. But you know, the fact is, Chief Preventer gets it. He understands the importance of prevention. He understands the importance of outreach, the importance, excuse me, but you know, and I'm very happy about, you might have heard about the police chief in Gloucester, who has been promoting treatment and working with his officers to help people navigate treatment. Let me let you in on something. Our chief, from a much larger community, has been doing that for many years. He's been working with his officers to try to make them change agents for change, positive choices going forward. So I'd like to just call up the chief at this point, if you don't mind, say a couple of words and about some of his words. Chief David Provencher.
I don't get this opportunity.
Good afternoon. You'll have to bear with me today. I'm having a real difficulty with my voice. I'm not quite sure if it's that my lungs just suck or if God's saying I've talked enough. So I'm not going to spend a lot of time up here, but yeah, it's very important, I think, to recognize a couple of things. And first and foremost, I remember back probably around 10 years ago, I gave a talk and Carl was there, and I said then, and nothing has changed. In fact, it's grown since then. But if there's anything important that we're doing in this city that involves addiction and recovery and saving lives, I don't have to look very far to find Carl House, because he'll be involved in it. And he's done an unbelievable job in leading the efforts in this community to help save lives. And that's really what we're all about. You know, I'm proud of a few things that I've accomplished in my career, but none more important than in April of last year, working with our EMS and fire department to get Narcan deployed out on the streets in every unit that responds to calls for service for possible overdoses. And I'm not thrilled to tell you, but I am proud of the fact that we've been able to save about 146 lives out of our responses, and we've had a 95%. But even more important than that, and I know it's hard to understand that anything could be more important than saving lives, is that we've had a 95% rate of all those we've saved with Narcan are still with us. And that's a number that really matters more than anything, because as Carl can tell you, and I'm sure he's talked about it, you know, before I got here, and that recovery is an ongoing effort, and we're going to have far more failures than we have successes. But I think the real critical issue for us is to stay at it, never give in, never give up, and keep up working hard to save lives. That's why we're all here. That's what our purpose is in being here. So I want to thank all of you for being here and joining us in this work. And when I look around the room, I see so many friends that I've spent a great deal of time working with on these issues. And that's how I know ultimately we're going to win. So thank you very much. And I'm really thrilled to be here with Kyle.
Thank you, Chief. Appreciate it. Again, we are blessed in this community to have a lot of great partners. And there's some new and exciting opportunities, and I'd like to call up Carrie Mello from South Coast Hospital. Carrie has been a long-time partner representing the community benefits as well as other parts of the hospital that are engaged in a lot of community activities. They've recently been successful at receiving a new grant, which hopefully will begin to assist with this transformation and help people access more treatment quicker with better outcomes. Carrie Mello.
Thank you, Carl, and thank you for all your amazing work, and also Chief Provencher. We're very strong partners with Carl and with the city. Unfortunately, we in our emergency department see the results of the epidemic of substance abuse, of overdoses. We've seen in all of our emergency rooms, not just here at St. Luke's in New Bedford, but also Charlton and Fall River and Toby and Wareham, over a 300% increase in the numbers of people we see. So it is an epidemic, and we all do need to work very closely to combat this. And I just want to take a few minutes to let you know today about several projects that, as Carl mentioned, we've been able to undertake with some grant funding. One, and I'll leave these little cards up there, is called Behavioral Health Connect. And this is a new tool that's available both to community providers but also to patients and their families. We, with the help of this grant, were able to do research throughout the South Coast, and there's over 1,000 pages of asset information, behavioral health resources for substance abuse, for mental health, and also resources because we know the social determinants of health really impact people's health as much as seeing a doctor, you know, and getting a prescription. So there's information on housing, on you know, on food resources, all sorts of stuff. So again, it's called Behavioral Health Connect, and I'll leave these little cards over here on the table. The second phase of this grant, which will be beginning this year, these are state-funded grants provided by the Health Policy Council, and they're called CHART, and I won't begin to, I don't even think I can remember what CHART stands for. But in phase 2, we're going to be working with a lot of community providers targeting those patients who are in our emergency department all the time. And this really is not the best form of care for them. So making sure those strong linkages have been established with community providers and providing the services that these patients need and deserve. So you'll be hearing more about that. It's going to be a 2-year project, and we'll be beginning it this fall. So I'm happy to be able to talk about that. And again, I'll put the card.
Next person I'd like to introduce is the director of our New Bedford Health Department, who has been very active in garnering resources to support our efforts as a community to reduce and eliminate, hopefully, overdoses as well as addiction. Join me in welcoming Brenda Weiss. Dr. Brenda.
So thanks, Carl. So as your health director, I'm not going to tell you that I have a good story. I'm not going to tell you everything's okay. We are in the middle of an opioid crisis here in New Bedford. I'm not going to lie about that. But our region, our state, our nation is with us. They share that burden that we share in combating this crisis. It's going to take all of us. We're going to have to put our differences aside, our personal agendas, to really roll up our sleeves and come to the table and work together. Now is the time. We are in a crisis mode. We've been getting along up till now. It's just not good enough. We got to move that dial on the trend of a rising opioid epidemic and change lives. It's really imperative. The good news is we have some incredible support. In a moment, I'm going to introduce our Mayor, John Mitchell, an incredible administration with incredible support. The Attorney General's office, the DA's office, the State Department of Public Health, and our local organizations coming together with a common vision. This is what it's going to take. This is what it's going to take. The Health Department has been very fortunate this past year to secure some funding from the State Department of Public Health. We have a number of initiatives ongoing. We have a regional coalition. Substance abuse has no geographic boundaries. We are working with Wareham, Marion Rochester, Dartmouth, our other partners, to create a regional coalition to tackle what our priorities are. This field is huge. The problem is huge. We need to work with PAACA. We're going to work with our clinical providers. We're going to work with our state, local, and regional partners. We need to figure out what to do. I don't have the answers. I'm sure Carl's not going to get up here and tell you he has the answers, but we are committed to the cause. So with that, I'm going to pass the baton to my boss, a wonderful guy, Mayor John Mitchell.
I was so pleased today when we pulled up just a few minutes ago and couldn't find a parking space. And that's the kind of problem I'd like to see, especially with a problem as pervasive but potentially solvable like this one. The opioid crisis hasn't snuck up on us. It's been building for some time now, and only really in the recent last year have all the providers, have all the folks who have some role to play in this, began really the hard work of collaboration. Now, collaboration is a little bit of a cliche term these days. We talk about it in public policy circles all the time, but if there's a problem for which only teamwork will solve, it's this one. And the motivation is right there. The motivation to deal with it, the motivation to stem the tide, the motivation to prevent is right before us. We all know somebody. Many of us have family members who have been afflicted with addiction. And we understand, we see the devastation that it leaves in people's lives, and there, unfortunately, examples abound. They certainly have here in New Bedford. And they certainly have in Massachusetts. You probably heard some data recently that 44 people die each day in the United States from an overdose. But we also know that Massachusetts is, by some accounts, first or second in the country per capita in that very dismal record. It's a big problem here in Massachusetts. It's a really big problem, and it's spread across to other states. We saw the news recently, Hillary Clinton and other presidential candidates on the campaign trail in New Hampshire saying, my goodness, this has become a really big problem here in the Northeast, and they were unaware of it. Well, it may have snuck up on them, but not on us. And so over the last few months, we've had occasion to come together first to launch the regional task force that Brenda mentioned, and there's going to be more of those efforts launched, similar efforts launched in the next few weeks. We have here it's a multi-dimensional problem that we all have opinions about attacking. Certainly, education is a big component. Regulating the use better of prescription drugs is a huge component. I think the governor and the attorney general deserve a lot of credit for hitting that nail on the head. In Massachusetts, prescription drugs are far too readily prescribed, and something has to be done about that gateway into the problem. But a lot of it's treatment as well. So I'm not here to prescribe all the solutions to it, but what I am here to say is by having an event like this, we heighten the attention that the problem receives, because it is a problem worthy of our full attention, and that's what we're going to get here in the city, working with state partners, and in a moment I'll introduce Steve Marshallek from the Attorney General's office, as well as our federal partners as well. This isn't entirely a law enforcement problem. This is not entirely a treatment problem. It's fundamentally a people problem where when we have loved ones who are suffering and loved ones who have the potential to slide down that slope. We've got to step up in a big way for the good of our community, for the good of our country. So let's take, if there's anything we're going to take away from this day, it's this. From this very hot room, sweaty room, let's take away this, that we're all in this together. Let's do it for our loved ones. Let's do it for our community. We will make significant progress. This is not something that we could just sit back and say, oh, there's nothing we can do about it. We can do something about it, and we will. So thank you, everybody. Let me introduce Steve Marshall. Steve Marshall from the Attorney General's office, who knows this problem very well. Steve.
Thanks, everyone. The Attorney General really wanted to be here today. Unfortunately, her schedule is such that she couldn't, but it was a priority that she got on the phone as soon as she became aware of this and told me to get myself down here, and I am here. I got to tell you, it's I'm sure you've had a lot of people talk about a lot of different things, and I wasn't here earlier, so I don't want to go into something that may have already been discussed, but one of the things I think is important is to get the word out there. To get the word out there about this thing called the Good Samaritan Law. And I hope if you don't know about it, you need to know about it. And if you do know about it, you need to tell your family and friends about it, because I consider myself a pretty educated guy. And 6 or 7 months ago, I really was unaware about this law. Once I became aware of it, I told my family, my friends about it. But basically, is if you're seeing someone that has an overdose, you're with someone that's overdosing, it's okay to call 911 for help. You won't be prosecuted if you do so. So I think it's an important point to get out there, to tell your family, tell your friends, tell your children, tell the teachers, just that you never know when it's going to happen, and I think it's important to get that word out. So it's a great event. Thank you for inviting us, Mr. Mayor. PAACA, you do a great work. Thanks.
Oh, I was going to have...
Oh man, again, the tall people. So today I have the pleasure again to introduce Jordan Paiva, who's a Portuguese Music Award winner and actually sang on stage with Josh Groban at the Dunkin' Donuts Center in Providence. Jordan's an avid participant for the American Cancer Society, Relay for Life. He's a force for good in our community. Today, Jordan will be singing You Raise Me Up by Josh Groban. Welcome, Jordan.
When I am down and oh my soul so weary, when troubles come and my heart burdened be, then I am still and wait here in silence until you come and sit a while with me. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. You raise me up so I can stand on mountains. You raise me up to walk on stormy shoulders. You raise me up to more than I can be. You raise me up to more than I can be. Thank you.
Talk about raising the roof, raising us up. Awesome, awesome, terrific. You know, there's been a few mentions. Is it hot enough in here for folks, or do you want me to turn up the heat? No, all right. You know what, though? If you can't stand the heat, get out of the kitchen, right? But nobody's leaving because we're committed to doing what is right for our families. We're committed to doing what is right for our community. And so I'm so grateful for all of you for kind of bearing the heat. You know, because every day, 365 days a year, this room is used for recovery. It is here for people to find a better way, to heal, to love themselves and love one another, to find a life, get back to work, find your productivity, find your purpose, and to help. And we can't forget that help piece because it can't just get better. I found that the people that survive this affliction the best are those that give it away and help one another. So I thank you all for being part of this. I want to close with a prayer from one of my best partners. We've been doing this work for I don't know how many years, Pastor David Lima.
I'm actually at a loss for words because I thought I was the one that was supposed to sing the song. I just don't know what to do now. It's been said this morning that it is a great turnout and it's wonderful to see you all here. And I'm going to tell you something different. I wish none of you were here. I wish we didn't have this battle to wage. I wish we didn't have this going on. But I understand that it is vital that you're here. And it's vital that we all understand the job that's ahead of us. See, the high that we were born with, that we wanted when we were children, was the high to be a singer, to have a standing ovation, to want to run for that touchdown and have the crowd go wild. We wanted to have the high that changed our life, gave us inspiration, and gave us the ability to say, I am worth something. That's the high we wanted. But for some of us, that's not the high we found. And then when we struggle and people don't understand us, when we don't give value to those that are around us, when we don't understand the battle and we just point fingers, then we don't have that high and we struggle to find it in places that we can't look because it just destroys us. Families where children are meant to be parents because they have to be, and it just affects our lives. But there is hope. And that begins with understanding that each person has value. And those aspirations that you may have had one day to be a singer or an actor or a football player or even a mayor or a police chief. Mayor, God bless you, my son.
Cross that one off the list.
The fact of the matter is, each one of you has value. You have the same value in the eyes of God as someone who's graduating from college or running that college or running the biggest company in the world. Each and every person has value, and it's up to us all to recognize that. The work has to be done. We can't keep rewriting the book. We need to continue the collaborations that the mayor had mentioned, and that word is used too many times for slogans, but we need to put it in practice. We need to use the people that are doing the job, that know the job, that are on the streets. And when funding is found, which there's never enough, we need to work with the people that are doing the work and bring everybody to the table. because that's the only way it's going to get done. Because we can't lose anymore. We can't see any more destroyed families. It affects us all, whether we care to hear that or not. If you'd bow your heads with me, please. Lord, as we leave here today, my prayer is that we come away with some new inspiration. A new thought that I can find healing. A new thought that I can find hope, and definitely a thought that I have worth. Each and every one of us needs to recognize that in ourselves. And then for those of us who have just that much more success than somebody else, we need to recognize that those that are struggling have worth too. And sometimes I need to lay down what I'm doing so that I can pick up my brother or my sister's arms, help them to their feet, and help them get to the next place in their life so that they will be there the day that I'm weak and the day I need help. Each and every one of us is in this together. And until we realize that, we will not see the success that you have asked us to have, that you have given us the gifts to give, and you have given us the ability to perform. Lord, give us the strength, the knowledge, the wisdom, and let us lay aside everything that prevents us to work together in this community to be able to see an empty room the next time we have an awareness day. That's my prayer today. In the name of our Lord, amen.
Again, we're all a little uncomfortable here, but not as uncomfortable as that next person that's overdosing, or the people that are pulling them out of third-floor apartments and those kinds of things that are then. We need to feel a little discomfort because it is through, you know that they say no pain, no gain? We're about to turn the tide here. We're reaching a tipping point. There are more and more people behind this effort. I want to thank the mayor for helping us put this together. Attorney Marshallek, Chief Preventer, Dr. Mello and Carrie Mello from South Coast Hospital, and everybody that's participated and is part of our team, because together we can. So everybody could go now out to, it might even actually feel a little bit cold. Thank you so much. Oh, yeah, one more thing, I'm sorry. We get to do this again. Actually, it's going to be outdoors. September 18th is Recovery Day, and there is a special program on October 1st. And that's going to be at White's of Westport. It's a professional development. There's information out there. It's all free. Thank you very much.
We're the stronger than we look type. The braver than you think type. The type that's sure the time will come when we put type 1 behind us. We're the progress is inevitable type. The rise to every challenge type. The type that knows bit by bit the future is certain to get better. We're the plan for a cure type. The improve life along the way type. The type that will stop at nothing. Absolutely nothing. Until type 1 becomes type none.